Hey guys, in this video, we'll be sharing with you the effects of smoking on your skin. We've scoured the entire internet for clinical studies to find what are the positive and negative effects of smoking on your skin, and unfortunately we cannot find any positive effects of smoking. So if you're a smoker or you have any family or friends that smoke, you might want to continue watching this video. Hey, but before we continue with the video, we realized that guys, most of you are not subscribed to the channel, so if you do not mind just smashing that subscribe button, it will help with the channel's growth tremendously so we can make more videos like this for people like you. Great, ladies and gentlemen, I'm Dr. Ingky, your digital skin doctor, and welcome to Skynfyx, the platform whereby we educate you everything about skin. Now, in these videos, we'll be sharing you 5 effects of smoking on your skin. Now, however, before we continue with the video, I would like to explain a term that I'll be using over and over again. In scientific communities and in the medical community, we generally use this term called pack years. So if you're a smoker, please listen up. What is a pack year? So a pack of cigarettes is 20 cigarette sticks. So if you smoke 1 pack a day and you've been smoking for the past 10 years, that means you have 10 pack years. So same thing as well, if you smoke 1 pack a day and you've been smoking for the past 30 years, it means that you are in the category of 30 pack years. But if you smoke 2 packs a day and you've been smoking for the past 15 years, you have the same risk as someone who has smoked just 1 pack a day for the past 30 years. So over the course of an entire video, we'll be using the term pack years. So this is how you calculate your pack years. So the first effect of smoking on your skin is premature aging. Now, we found several clinical studies, but the clinical study that we want to highlight is this one right here at the side. So it's been scientifically proven that smoking actually causes premature aging. So we have found multiple clinical studies, but there's one clinical study that we want to highlight, which was done by the Koreans. So in 2001, a study was published in South Korea regarding premature aging, namely wrinkles, and its correlation to smoking. So what they did was they followed around 400 men and women in South Korea. Some are smokers, some are mild smokers, and some smoke a lot per day. So what I've noticed is in women who smokes, they actually suffer from premature aging at a much quicker rate compared to men that smokes. It means the onset of wrinkles for a woman that smokes actually appears much earlier. In women who smoke less than 10 pack years, their occurrence of wrinkles is actually 50% much quicker than women who didn't smoke. And those women that had 50 pack years, they actually had 5 times more wrinkles or 5 times quicker onset of wrinkles compared to the counterparts who never smoked. Now, in terms of men, it's slightly different. Now, the men that smoked did not show a higher incidence of wrinkle appearance compared to men that didn't smoke. However, for men that smoked, there was actually appearance of something called seborrheic keratosis. Now, seborrheic keratosis is this benign small skin tag or skin tumor that sits on your skin, and generally it sits not only on the neck and on the face as well. And men who smoke, the more pack they smoke, the more seborrheic keratosis they actually had on their skin. Now, why is that smoking causes premature aging? Now, smoking actually activates this protein called metalloproteinase, which degrades your skin's collagen, its elastic fibers, much quicker than regular. Now, smoking also reduces the amount of TGF-beta-1, which is transforming growth factor beta-1. Now, the function of TGF-beta-1 is actually to repair your skin at a much quicker rate. It means that your collagen gets repaired quicker, your elastic fibers gets repaired quicker. But with lesser TGF-beta-1, what happens is now there's slower repair process. It means that not only is there a faster breakdown of your collagen isn't being able to be repaired in time, and hence all this leads to more wrinkles to appear on your face. Now, all of these will lead to something what we call smoker's face. Now, what is a smoker's face? A smoker's face is actually characterized by very thin skin, atrophic skin. Now, it's because of the breakdown of collagen in your skin. So because of that, smoking causes premature aging. Now, the second effect of smoking on your skin is smoking triggers psoriasis. Now, psoriasis is this chronic skin issue whereby there's thickening of the skin throughout your entire body or certain parts of your body. Now, psoriasis is difficult to treat, and we haven't really pinpointed one single reason why psoriasis appears. But now we know that psoriasis is actually a multifactorial disease. That means it's actually caused by many things from genetics and from smoking as well. Now, we found this study by the NHS, which was concluded in 2012, and they followed 185,000 participants from the years of 1986 all the way to 2001, and discovered that smoking increases the risk of psoriasis. What they have discovered is if you smoke less than 10 pack years, you have a 19% chance of developing psoriasis. So what I've discovered is if you have smoked less than 10 pack years, your risk of developing psoriasis is 19% higher than someone who has never smoked in their life. But if you smoke more than 10 pack years, your risk jumps from 19% to 270%. That means the more you smoke, the higher the risk of psoriasis. Now, why is that? Now, psoriasis is something known as a systemic inflammation. That means there's inflammation all over your skin, throughout your entire body, and hence psoriasis appears. Now, smoking actually activates something called tumor necrosis factor alpha, and that in turn stimulates your T lymphocytes and then leads to chronic inflammation. That means, in simple terms, if you smoke, the higher risk of developing something called psoriasis. Third effects of smoking on your skin, it causes atopic dermatitis or skin allergies. Now, someone with skin allergies generally have a higher level of IgE, which is immunoglobulin E. Now, IgE is part of your immune system and is generally triggered when you're exposed to things that you're allergic to. Now, the thing about smoking is not only are you inhaling smoke and you're inhaling certain chemicals, but your lips and your tongue actually comes in contact with the filter. Now, cigarette filters are actually known to have a lot of allergens, things like formaldehyde, which generally your body cannot accept. Now, as you smoke, you are exposed to all these allergens bit by bit on a daily basis. And what happens is now your body is now sensitized to all these allergens. Now, sensitization means that you don't develop very strong allergic reaction, but you do develop it from time to time. Now, there's a study which we are actually showing here, which shows that if you are a smoker, you're a current smoker, your IgE levels is roughly at the level of 300 international units. Now, compare that to someone who has stopped smoking, which is half the amount, 177, and someone who has never smoked is less than 30. That means if you're currently an active smoker, you have 10 times more IgE compared to someone who has never smoked in their life. And hence, your risk of developing chronic eczemas or sensitive skin is much higher compared to people who have never smoked. So, hence, smoking causes skin sensitivity. Fourth of all, smoking causes balding. Now, if you're a man of East Asian descent and you're a smoker, I have bad news for you. Now, there is a study which follows about 740 people in Taiwan, and they were trying to replicate a study done in Korea. And they found that men who smoked above the age of 40 actually have a higher incidence rate of male pattern baldness compared to the counterparts who have never smoked in their lives. And they discovered if you're an East Asian descent, that means from Korea, from China, and from Japan, smoking actually speeds up the rate of male pattern baldness. Now, all this is even made worse if you have first-degree relatives or second-degree relatives with male pattern baldness. That means that if you have a brother, an uncle, or a cousin with male pattern baldness, and if you smoke, your rate of male pattern baldness is much higher, sometimes even up to twice the amount of a non-smoker. So if you value your hair, please stop smoking. Now, the fifth and final effect of smoking on your skin is reduced wound healing. Now, back when I was working in a hospital, generally when anyone comes in with trauma or skin infection, we will always advise them to reduce or stop smoking. Now, why is this? This is because that when you smoke, you actually reduce your microcirculation. Now, what this means that there is lesser blood being flowed to certain parts of your body, and that is actually necessary to actually repair your skin and your wound as well. So the lesser blood supply you have, the slower the wound healing. Now, there are clinical studies that shows people who smoke actually have a higher incidence of mouth ulcers, they have a higher incidence of not only psoriasis but as well as injuries on their skin, because minor scrapes and bumps actually causes your skin to bruise much easily, and as well as the wound to heal at a much slower pace. And what's worse is if you're smoking and you're diabetic, there's an increased risk of gangrene happening at your lower limbs. So what happens in diabetes is you actually have reduced sensation in your toes and at the bottom of your foot. So many a times we have seen diabetic patients who have stepped on a sharp object, whether it's a nail or glass, and they do not know that they have actually stepped on it. And due to the reduction in sensation and reduced wound healing, those wounds generally tend to get infected and over time become gangrenous. And when they become gangrenous, the only thing that we can do is to chop off the foot. So smoking actually reduces the rate of wound healing. So there we have it, guys, 5 effects of smoking on your skin. Let me know in the comments below whether you agree or disagree with our findings, and let me know what other effects of smoking on your skin that you know that I've missed out. Now, if you have enjoyed videos like this, please smash the subscribe button, like and comment below, and please share this video with your family or friends who are currently smoking. I'm Dr. Ingky, your digital skin doctor, and until next time, stay safe, stay healthy, and most importantly, stay informed. Are you tired of wasting time and money on your skin, but nothing works? We are here to help. Skynfyx is a platform that provides personal care education completely free. Skynfyx is run by skin doctors and skincare experts. You can chat and consult with our skin doctors without ever leaving your home. Other than free advice, Skynfyx also provides tailor-made solutions for your skin problem with customized medical-grade skincare delivered right to your doorstep. Skynfyx, your digital skin doctor.